Have you ever realized there's a vicious killer among us? With 50 people dying from heart disease every day, coronary heart disease is no doubt Malaysia's #1 killer. Hi, I'm Ching.
I'm Min.
And I'm Leona. We'll be discussing about hydrogels that can repair heart tissue. Frischman and her team from Ventrix invented a hydrogel that can be injected into heart tissue.
Heart connective tissues of pigs, which has the most similar heart structure as humans, is stripped off. The decellularized tissue is freeze-dried, milled into powder form, and liquefied into a fluid that can be injected into heart muscles via a minimally invasive procedure.
After being injected into damaged cardiac muscle, the hydrogel forms a scaffold which has more linkage that acts as a reparative environment to which healthy cells migrate. This offers a new healthy microenvironment within the myocardium to facilitate cardiac repair. This treatment has successfully undergone its first in-human clinical trial and is now working on a second phase clinical trial.
By having this hydrogel works, it improves cardiac function in both subacute and chronic myocardial infarction preclinical models. For now, there's no established treatment for heart attack, where the resulting scar tissue can diminish muscle functions and cause heart failure. With this technology, it helps to mimic the native extracellular matrix scaffolding in the heart, which leads to increased cardiac muscle, reduced scar tissue, and improvements in heart function. Heart diseases such as heart attack can be treated better using injectable hydrogels.
This technique has a large potential for growth in the future because for now, technology used such as stent placement, bypass surgery are not a permanent cure for heart disease. The fact that the body's natural response after a myocardial infarction leads to scar formation, preventing the heart from functioning properly, eventually leading to death. The ability to lessen our reliance on heart transplant would be a profound step forward in improving the patient's rate of survival.
There are things to harbor through though, like degradation rate, gelation time, and mechanical stiffness of the hydrogel. To date, no hydrogel composition has shown both the necessary biological and mechanical properties for sufficient transition to clinical cardiac tissue repair. Therefore, a larger scale of clinical trials is needed to know more about the effect of hydrogel in different individuals and to have more evidence on safety. All in all, clinical trials have shown improvements in wall thickness, left ventricle repair, and vascularization of the ischemic region with the use of hydrogel. This gives us hope for this technique to be implemented on humans.